Hello, my name is Daria Lauer, and I'm here to talk about telehealth and access to eye care. My co-contributors are Dr. Matthew Tuckle, Alexander Ortiz, Dr. Jay Kim, Dr. Anju Goyal, and Dr. Lisa Kelly. Today we will discuss the definition of telehealth, the eye health of different populations, and barriers to care. We will also discuss the current state of teleophthalmology and the future of telehealth in ophthalmology. The definition of telehealth is the delivery of care over time or distance using electronic communication technologies. In this presentation, we will focus on asynchronous telemedicine, which is the transmission of healthcare data to a provider for evaluation without using real-time interaction, such as when medical images are sent to a specialist. This is the most common telehealth modality used in ophthalmology. So why is telehealth used in ophthalmology? First, it can provide preventative measures for vision loss in the primary care setting. Second, it can provide access to eye care for patients in remote areas. Some reasons to consider using telehealth for eye care include the fact that many underserved patients develop vision loss, which could have been prevented or delayed. Race, ethnicity, and low socioeconomic status are associated with increased rates of vision loss, placing vulnerable groups at higher risk. In addition, systemic diseases, which may have ocular manifestations, have higher prevalence among certain populations. For example, American Indians or Alaska Natives have the highest prevalence of diabetes in comparison to other ethnic groups in the United States. Poor prevention can lead to advanced disease, which can cause a significant economic burden to society. We also know that preventative measures are less likely to occur in populations with lower socioeconomic status and education levels. It is important to consider some of the factors that can affect the use of telemedicine. For patients, barriers may include varying levels of patient education and lack of access to technology platforms used to deliver care. There can also be barriers for physicians using telehealth, including prohibitive startup costs, lack of reimbursement, and the limited diagnostic capabilities of telemedicine in comparison to those of an in-person office visit. Other important social determinants of health include the physical environment. Lengthy travel times for patients living in rural areas discourages the use of specialty eye care for non-emergent purposes. A patient's economic stability also plays a role. Even if patients are aware of the benefits of eye screening, cost beyond their usual copay is often prohibitive. Other major barriers to eye care include patient transportation to and from appointments, a patient's level of trust in their physician, a patient's level of health literacy, and a patient's insurance coverage. Primary care providers, or PCPs, can use telehealth to increase patient access to eye care using the following model. First, a patient at high risk for ophthalmic disease is identified by their PCP. The PCP takes fundus photos which capture the patient's disease state for diabetic disease, macular degeneration, or glaucoma. Then the images are transmitted to an off-site specialist who reviews the fundus photos and sends diagnoses and management recommendations back to the patient's PCP. This model for teleophthalmology is applied to various eye diseases. We'll start with diabetic retinopathy. Telemedicine has been shown to improve evaluation for diabetic retinopathy through PCP retinal imaging with remote interpretation by an expert. Retinal imaging by a PCP could reduce barriers and improve early detection of diabetic retinopathy. Non-mydriatic fundus photography is a useful tool for screening in rural settings during annual eye exams and has been shown to increase the rate of evaluation for diabetic retinopathy. This asynchronous telemedicine model has been used by the following programs to provide diabetic retinopathy screening for remote populations. The Indian Health Service and Joslin Vision Network serves American Indians and Alaska Natives. The Kewa Pueblo Health Corporation and SEVA provide care for American Indian communities. And the Department of Veterans Affairs uses this model to expand access for veterans. Teleophthalmology has also been used for screening, diagnostic consultation, and treatment monitoring for glaucoma. Here, data from a PCP is analyzed electronically by eye care specialists. Teleglaucoma may require more diagnostic tests, such as optic nerve photographs, optical coherence tomography, intraocular pressure measurements, central corneal thickness measurements, and visual field tests. NYU put this into practice during the COVID-19 pandemic. Patients were sent eye care home tonometers to acquire intraocular pressure data. They used a mobile app to check their visual acuity at 14 inches and an Amsler grid to check their central visual field. During a virtual visit, an ophthalmologist reviewed visual fields, prior OCT, patient medications, and eye care home tonometer measurements, allowing for safe, collaborative virtual glaucoma visits during the COVID-19 pandemic. Here are examples of the telehealth screening tools used for glaucoma. On the left, there's an eye care tonometer used to check the intraocular pressure at home or in the office. On the right is a virtual reality machine which can check visual fields. Telehealth is also being used for retinopathy of prematurity, or ROP screening. Infants can be evaluated via remote retinal photography by an ROP specialist. One specific example is Stanford's SunDrop tele-ROP screening program, which found tele-ROP to have a sensitivity and specificity approaching 100% in over 1,000 eyes. Looking ahead to the future of telehealth and ophthalmology, there are new technologies coming. For example, there are innovative deep learning artificial intelligence systems that have taught themselves to identify signs of diabetic retinopathy and macular edema in fundus photos, as well as age-related macular degeneration and retinopathy of prematurity. The fundus photos used to identify these disease processes can now be captured using a smartphone-based fundus imaging. In summary, telehealth uses electronic communications technologies to deliver care, provide diagnoses, educate, and manage patients over time or distance. Telehealth has the potential to expand access to specialty care in underserved and rural communities. Common current uses include screening for diabetic retinopathy, retinopathy of prematurity, and glaucoma. Patient barriers to telehealth include limited access to technology platforms, varying educational levels, variations in insurance coverage, and perceived increased costs. The future of teleophthalmology is bright, and many new technologies and uses are currently being investigated.